Houston Veterans Community Health Clinical for UT Health Science Center School of Nursing, Spring 2016. By Grace Acham, Melanie Bradshaw, Haley Edmiston, Sandra Goodhead, Joanna Leha, Emily Murray, and Stephanie Rosado Rosa. Veterans in the United States have faced many hardships related to unemployment, financial difficulties, physical disabilities, traumatic brain injury, post-traumatic stress disorder, depression, suicide, issues with substance abuse, domestic abuse, homelessness, sexual trauma, and other problems that are unique to veterans, such as exposure to Agent Orange. Many lack access to the help they need and thus seek assistance from the Michael DeBakey VA Hospital and nonprofit organizations such as U.S. Vets and Haven of Hope. Here are some facts about veterans in the United States and in Texas. It is estimated that there are approximately 21.8 million veterans in the United States, with 88% of those being male and 12% being female. 80% of veterans are white, 11% are black, with less than 2% being Asian or American Indian. In January 2015, it was estimated that there were over 47,000 veterans that were homeless. In Texas, there are approximately 1.6 million veterans, with over 80,000 residing in the city of Houston. The majority of Houston veterans are males over the age of 55. And 21% of Houston veterans live with some sort of disability and therefore have a need for to observe the veteran community in Houston. We rode with the Houston Police Department and U.S. Vets on their homeless outreach teams and went on home health visits to veterans with mental health issues to keep them independent in their home setting. However, for the majority of the semester, we were divided into 3 cohorts, each working at a different facility. Stephanie and Joanna were at U.S. Vets, a living community and outreach for homeless veterans. Haley, Grace, and Emily were at Haven of Hope, a shelter for female vets and their children. And Sandra and Melanie were at Michael DeBakey VA Hospital on the palliative care and stroke units. Throughout the United States. Their primary service is providing transitional or permanent housing for homeless veterans through their various programs, but they also provide job assistance, financial assistance, and counseling services. Joanna and Stephanie performed functional assessments on many veterans in the transitional program to obtain data for their intervention. The functional assessments comprised of 4 components: functional impairment, gait instability, cognitive impairment, and major depressive screen. Based on the findings, their community diagnosis was risk of injury from falls and immobility among the residents of U.S. Vets Houston related to chronic disease and knowledge deficit among the staff at U.S. Vets regarding fall prevention and rounding, as evidenced by medical emergencies requiring use of emergency medical services several times per week, aging population of veterans at U.S. Vets, and statements from U.S. Vets staff regarding concerns of falls and frail condition of some residents. They chose this intervention because prevention of falls is important for reducing injuries that could lead to functional impairments and subsequent loss of independence, as well as depression. Their goal was to decrease number of falls and injury among the residents of U.S. Vets Houston, as evidenced by a decreased use of emergency medical services to 4 times per month over the next 6 months. U.S. Vets were as follows. Following a presentation about rounding by the UT Health nursing students, staff of U.S. Vets Houston will be able to 1. State the principles of rounding, 2. Demonstrate correct rounding technique, 3. Identify veterans to be rounded upon, 4. State a schedule for rounding, and 5. Document rounding. Care unit has a great setup with patient rooms surrounding a central nursing station, a gathering room for clients and guests with TVs, coffee, an Xbox game station, and dining for about 20 to eat and recreate. There are some wonderful procedures in place to honor veterans upon their death, such as a draped flag, final salute, and the playing of taps as the veteran's body leaves the unit. In addition, there's a special butterfly room for family members to use when their family member has passed. While there were great ideas that had been implemented post-mortem, we witnessed many nurses and other healthcare providers under ethical distress due to fatigue, short staffing, and personal or professional barriers. As a result, some of the veterans' most basic needs were not being met, and many of the patients were left alone. Diagnosis of risk for feelings of abandonment related to ethical distress, as evidenced by staffing shortages, employee fatigue, limited patient interaction, and lack of advocacy and commitment to patients. Our goal was that all healthcare providers on the palliative care unit at the VA hospital would participate in continuing education focused on providing ethically sound care, as evidenced by 100% of staff completing a pretest, participating in a presentation, and a post-test with a score of 90% or better. We created a 30-minute continuing education presentation video for the staff on the unit regarding ethics, burnout, and how to prevent and alleviate both. In addition, we created a pre- and post-test for staff to measure their learning. We received a positive response to the presentation, and the VA is looking forward to adding our CE presentation to their staff resources. The unit's management agreed with our assessment. Our recommendation is that the hospital management further assess the ethical distress that is occurring on the floor and implement changes that will address our nursing diagnosis. Facility for homeless, single, female veteran mothers and their children ages 0 to 12. The facility provides private rooms and a shared bathroom for the women to use for up to 18 months while they are going to school or working. The staff at Haven of Hope provide 3 structured meals a day and have weekly classes to teach the residents various skills. During our time at Haven of Hope, we listened to the stories of the women who wanted to share and their goals for their future. The residents with the goal of determining community needs. While interviewing the residents, we discovered that a common problem expressed was a need for nutrition teaching. The residents expressed requests for information regarding diet and procedures unique to various health conditions, such as a heart-healthy diet, information regarding lap band surgery, and what to eat while pregnant. After speaking to the staff of Haven of Hope, it was recommended that we put on a social event for the residents with the intention of promoting social interaction. We were unsure if this was the right direction to go, but unfortunately felt pressured by the staff to host the social event. Much time was spent planning and gathering donations from various community sponsors, such as Kendra Scott, Chick-fil-A, Michaels, PDQ, and various individual donors. The social gathering was enjoyable and well attended. However, only one of the 8 residents attended the party, and she only got food and then left. The lack of participation by the residents was a disappointment to us, as the social event was planned for them. In doing a summative evaluation, we found that the residents did not perceive social interaction or recreation to be a priority problem and would have preferred another intervention that would have better met their needs, such as health teaching. Clinical experience. 1. For future clinical groups working with Haven of Hope, we recommend no further social events should be planned without specific indication by the residents. And 2. For everyone in community health nursing, please learn from our experience. Community health interventions must always be focused on addressing the felt needs of the target population, despite insistence of other players in the community. Using nursing judgment to accurately assess and address the perceived felt needs of the target population is paramount. Overall, we thoroughly enjoyed our clinical experience. We gained so much insight into the veteran and homeless populations, as well as disparities in the community health setting. Each of the students would like to thank our clinical instructor and mentor, Dr. Bridget Pullis, for her advisement, support, and providing us with such wonderful opportunities.